pray. Let us pray. Oh, Heavenly Father, we come before thee this morning with bowed heads and humble hearts. Heavenly Father, we ask that you bless this assembly. Bless our nation. Bless our state. Bless our leaders. Bless us that we might grow in your name, in your love, and your grace. Bless us such that we might make decisions that are in the best interest of those that we represent. Now, Father, when we can no longer serve and admonish your name, we ask that you keep us. Be merciful unto us. These blessings and many more we ask in thy name.
Amen. All right, thank you. We have, I believe, 4 resolutions this morning we're going to cover. You know, I want to thank this committee. Don't start until after the crossover day, and we had a total of 51 resolutions to look at this session, and 46 of them for study committees. So as we were talking earlier, we want to hear as many as possible and pick those out that we can, but with 46 we would be very close to having to use members of the House 3 or 4 times on different subcommittees. So but thank you all for that have had the resolutions and that we've been hearing. You know, first of all, I'm going to start off this morning. Chairman Sharon Cooper had a resolution that she wanted us to look at, and it's resolution number 1536, and she could not be here this morning, so Representative Susan Holmes is going to present the resolution for her.
Chairman, ladies and gentlemen, this resolution recognizes and commending the National PTA and its constituent associations for their efforts to address the dangers of e-cigarettes and related products, and urge local efforts to continue to address such dangers. This was my first really experience with learning a little bit about e-cigarettes. I've heard about them, but I didn't know a whole lot about it. So reading this is very interesting to me. Electronic cigarettes and other electronic nicotine delivery systems, which are called ENDS, the acronym EMS, will prohibit the advertising, marketing, and selling of such products to youth, and will prohibit the use of such products in public places and on school grounds. And the National PTA has a concerted effort to do this. CDC shows that e-cigarettes and ENDS used among cigarettes in grades 6 through 12 have tripled over the course of 1 year's time and are the most commonly used tobacco products among youth today. That was certainly news to me. E-cigarettes and other ENDS are available in more than 7,000 fruit and candy flavors. So that tells us just how very popular they are. There are no federal restrictions in place preventing the sale and advertising of e-cigarettes and other ENDS to minors. There's no regulatory oversight of the manufacturing process, and deaths have occurred as a result of using e-cigarettes and other ENDS and the liquid form of nicotine. E-cigarettes and these other ENDS products contain nicotine, which is, as we know, a highly addictive drug that has immediate biochemical effects on the brain and body. So this resolution is encouraging the House of Representatives, the members of this body, recognize and commend the National PTA and its constituent associations for their efforts to address the dangers of e-cigarettes and related products.
Thank you very much, Representative
Yes,
Holmes.
Thank you
And
very much.
on short
Thank you.
notice, does anyone have any questions of, let's see, number 12?
Yes. I want to thank Representative Cooper and her team for actually bringing this resolution forward, because this just happens to be one of the subjects that the young people in my district have been talking about. They have been talking about it for years, because it's my understanding that they thought that initially that this e-cigarette would sort of, prevent them or what, from maybe smoking real cigarettes and so forth. And one of the young ladies went back and she did some research. And so I said, you know, maybe I need to look into this also. So I saw a new research where they find that the e-cigarettes can double the risk of heart attack. And this research was conducted at the University San Francisco in California by one of the professors of medicine. And he studied 70,000 individuals. So this appears to be a serious problem. And as I say, the only reason I got interested is because the young people that I work with, and I meet them the second and fourth Tuesday every month at my church. And we usually have a very lively discussion. So I just want to thank you all for bringing this resolution forward. And hopefully, you know, we can do some serious studies, or I don't know just what the, you know, the wishes of the committee is. But this is taking on to be a serious problem, especially in the high schools.
Okay, thank you for those comments. Number 8,
Mr. Chair, at the proper time, I'd like to make a motion.
it is the proper time.
Move due pass.
Have a motion to pass and a second. Is there any discussion? All those in favor, aye. Opposed? Motion carried. And thank you, Representative Holmes, for doing that for Chairman Cooper. Next on our agenda this morning is House Resolution 1540, Representative Vernon Jones.
Thank you, Mr. Chairman, and members of this distinguished Special Rules Committee. This is my first time coming before you. I appreciate the opportunity to bring this simple but very important resolution before you. What this does, Mr. Chairman and members of this committee, is to encourage Washington to invest in our infrastructure. Having served in local government and had to be responsible for local water and sewer and roads and bridges, it is important that we do invest in our infrastructure and use as much as we can in terms of leveraging local, state, and federal dollars. And what this does, obviously, is, again, to encourage Washington to invest in our infrastructure. You know, we're seeing where bridges are crumbling and people are losing their lives. We're seeing other instances where we need to improve our transportation initiative. Even with Georgia, when we passed the transportation plan a few years ago, those dollars can be used to leverage more federal dollars. And so we're looking at asking or urging Washington to invest about $200 billion. That would probably net about a $1.5 trillion across the lands, again, to improve, and particularly to rural areas. I happen to represent a part of my district that's partially rural as well. And so Mr. Chair, members, we thought it was important to bring this before you and see if we can receive your favorable consideration.
Okay, thank you very much. And let's see, number 1.
Thank you, Mr. Chairman. Great resolution. Appreciate you bringing this, and we certainly need to work on infrastructure. I just wish you would have added a line that suggests maybe they actually pay for it, since we just went over $21 trillion in debt yesterday, that they actually cut some spending and come up with actual funds. But appreciate you doing this.
You know, Mr. Representative, I believe in a balanced budget amendment. Always have been, and can't spend what you don't have. But I feel you on that. I support you on that.
Are there any other questions or comments for Representative Jones? Number 8.
Thank you, Mr. Chairman. I think this is really definitely in line with what we're doing here in our state, especially with the infrastructure piece in House Bill 170 we passed about 3 years ago now. And at the proper time, Mr. Chair, I'd like to make a motion.
All right, we do have some other comments or questions. Number 14.
Thank you, Mr. Representative, for bringing this resolution. And I think it would be good to urge Congress to take the lead that we have done here in Georgia. I mean, I think we've gone a long way to start fixing our infrastructure, and we look forward to federal government doing the same.
Now would be the proper time for a motion.
Move to do pass.
I have a motion to pass and a motion second. Any further discussion? All those in favor, aye. Opposed? Motion carried.
Thank you, Mr. Chair and members of the committee.
Thank you, Representative. Next on our agenda this morning is, and I did add this late because we wanted to hear this resolution, House Resolution 1321, Clay Cox. This resolution will be a hearing only. Representative Cox, thank you.
Thank you, Mr. Chairman, members. This resolution 1321 is actually the, I guess, the result of a House Bill 737 that passed unanimously out of Public Safety this year. And when we got to rules, noticed that it really brought to the surface a number of other issues relative to this particular issue. The bill originally was going to allow law enforcement officers the same rights, if you will, to request that someone they're arresting who, during the arrest, during an altercation, for example, bleeds on that arresting officer's open wound, whether or not the open wound was caused by yard work during the weekend or actually occurred during the altercation itself. Current code in Georgia is basically what we cut and paste into the proposed House Bill 737, allows some medical workers, correctional officers, and even victims of sexual assault to do just that, to request a blood test, and if refused, the court would then mandate that blood test. And that was the bill. And what we learned, and as I worked with Chairman Sharon Cooper, is that all of the language that we have in our code is essentially outdated relative to testing for HIV and hepatitis. And so what the study committee proposes to do is to look at all the updates that have occurred in dealing with these issues as far as medical interventions, medications that are available now, and even funding mechanisms that under state laws in other states relative to workers' comp and other resources for funding could provide protections to our state employees and healthcare, law enforcement, and corrections as well, and even the victims of sexual assault. So it's really sort of evolved into an effort to examine what's going on relative to those issues in our state law and updating those laws to protect our state employees as best we can.
Are there any questions? 13.
Oh, and thank you for bringing the resolution. I'm a sponsor on this, and he and I had a conversation. I'll just share you an experience that I had. I work in the emergency room. I'm a physician assistant. I've been doing this for 18 years. And oftentimes I get either hospital employees or even law enforcement get exposed to HIV. And a specific example I wanted to share with the committee, and as a reason why we need to be doing something like this, I had a deputy sheriff in a county where I was working in a small rural hospital, came in and he said he was potentially exposed to HIV because an inmate was a known source, HIV source, taking HIV medication, antiretroviral medication. But the inmate that he had to subdue and arrest and control was the boyfriend of the other inmate. And so, but that inmate's status was not known. HIV status was not known, but it was clear that the boyfriend was HIV positive and was taking antiviral medication. And so this deputy had secretions in his eye. That's why he came in to be medically screened. And I asked the deputy, please get that inmate's consent. You have to get consent under current law to know his status because he was high risk. So I had to treat this deputy as a high risk exposure. And so he went back, and actually the inmate consented. He was kind of being obstinate and a little bit out of control, but he did consent. We tested this inmate, and the inmate was positive. Right. And so now I have a young 25-year-old deputy sheriff with children and a family now has been exposed to HIV. And so that's the gravity of the situation that we're sort of dealing with out there in the real world. And so I commend you for bringing this resolution, and I think it's a good idea to review our laws on this issue.
All right, I guess I have one question.
Yes, sir.
You said that there was a bill to address this, but the bill did not get passed. Is
Right,
that
we,
correct?
we passed it unanimously out of public safety, and when we got the rules and kind of expanded the conversation, the bill certainly would have made it out of rules and passed, but basically what we would have been doing was taking really obsolete language that's afforded to other state employees outside law enforcement, giving it to the law enforcement officers, and really doing no good. It's outdated language. It doesn't deal with or deal with the access to the new medications that are involved, new policies that are involved, and even the funding mechanisms and resources that could be involved. So it really just doesn't make any sense. What the better approach, it seems, is to come up with some language that addresses all of our industries as far as dealing with subjects that could be positive for these diseases. So.
Number 12.
Yeah, that was basically going to be my question as well, because I remember the bill.
Right.
And my question is, do you plan to look at various studies that have been done in this area?
No doubt. I mean, we have a tremendous group of resources here in the Atlanta area with CDC and Georgia Public Training Centers. It's an abundance of information that should result in a really good product that does what it's intended to do without bringing. We don't want to hurt anyone. We don't want to bring stigma to people or hurt anybody doing this. So we just want to be real careful and make sure we're doing something that's appropriate for everybody concerned.
Because with all the research that's already out there, I have a friend who's one
Right.
of the supervisors at CDC, and he talks about this area all the time, and all the research that they have done in this area.
Yeah, it's almost like cell phone technology. It
Yeah.
advances so quickly and it can become obsolete very, very quickly. So we're going to be real careful the committee moves forward on this to
Yeah.
make sure that we're coming up with a product that makes sense.
I just didn't want us to study this to death, you know?
Right, you bet,
Okay.
absolutely.
Number 14.
Thank you, Mr. Representative, for bringing this, but I guess I'm pretty much like most of the other members, is that I don't know when that we need to study as much as we need just legislation. Let's go on and, do it. Basically, isn't there sample legislation someplace in other states that have addressed this issue?
There are, and Chairman Cooper and I looked at that, and a couple of states that have moved forward. But just even last year, some medications have been coming out of trial, and by the time this is studied and hopefully results in a bill, we'll have some protocol history on those that we may be able to include in legislation next year. That would actually have a timing that makes sense for inserting that into a bill. So.
Number 9.
Thank you, Chairman. Thank you, Representative, for bringing this bill. Question, and I guess just from the dialogue, I'm just trying to understand. So this study committee, you wanted to study different protocols and opportunities to determine whether or not there should be legislation to force someone who did not consent to a blood test without having a court mandate. Is that the thought behind this?
That will certainly be, that was the crux of the original legislation. And one of the advantages of approaching this through a study committee is that the committee will be able to examine related issues to that. Protocols involving new medications. Does workers' compensation, for example, need to pay for something called PEP that the potential exposed state employee can be involved in immediately? There's medical interventions that are available now that, and rather than just focusing solely on the blood test issue, what do we need to be getting people involved in medical intervention who have a potential exposure right away, and do we need to codify that so that police agencies in South Georgia with 4 officers have access to that, as well as the larger departments who probably already have protocols in place and access to funding. So.
Number 1.
Thank you, Mr. Chairman, and I appreciate this bill. And you get talking about some of this stuff. It's got I can certainly see where the study committee's going to have their work in front of them, because you also got to balance the HIPAA laws that protect all these people's rights for, they don't have to ever disclose any of that. I mean, right now, a doctor can't even tell a spouse that their spouse is HIV positive without their consent. So there's a lot of areas in here, even some of the things under the OSH Act that we see out of the Code of Federal Regulations dealing with bloodborne pathogens. this would be quite an extensive committee to work on, and,
No doubt. The gentleman is correct, and as the discussion here clearly illustrates, moving forward with the bill just for the sake of getting a bill passed on this issue just simply wasn't the correct approach. It really, if there ever was a need for a study before doing something, I think the discussion here illustrates the need for that in this case.
Number 13.
I don't know what the will is of the chair on this resolution. I know it's a hearing only, but do you foresee or could hint that we could move on this resolution, or is this something that the Health and Human Services Committee could create their own study committee within their own committee to study this issue? Because I think it's necessary, but I don't know where the chairman is on that.
All right. Well, this is a hearing only because, as I said earlier, we've got 46 study committee requests, and we have been trying to hear them and then compare as we go along. So it will be a hearing only today. But thank you. Are there any other questions?
I appreciate y'all's time.
Thank you very much.
Thank you.
All right, we have one other, H.R. 388, Representative Tom Kirby.
All right, thank you, Mr. Chairman. I bring you House Resolution 388 today, one I originally proposed last year for a study committee. You know, we have talked about a shortage of nurses in this state for years. And we've talked about rural health care and the opportunities we have there for years. And really taking all those, put them together, that's what this committee's about. Let's look at what our nurses actually do. And there's so many different types of nurses today. There's RNs, there's LPNs, there's clinical nurse specialists, nurse practitioners, case nurse managers, CNAs or certified nursing assistants, nurse technicians. You had some phlebotomists in there as well. What can they deliver? You know, last year in Health and Human Aging Committee, or I'll get it right here in a minute, Human Relations Aging, we actually had a bill, we talked about and passed it, where if you had a parent or family member that was sick and you were caring for them at home, and the doctor had a set of medicines, prescriptions they would give you, you would make sure they took it on time, properly, you know, one before dinner, whatever it was. But if they were in a skilled nursing facility or a nursing home, as commonly referred to, you'd have to be an RN to make sure they took that medicine. So the bill, what we passed last year, would allow somebody to go through a course, be trained to make sure that people are taking their medicine properly on time without being an RN. And there's lots of little things we've run into across this state where there's a shortage of RNs because there's such high demand, because there's things like giving out medicine only an RN can do. That we need to look at the education of what all these different nurses are doing. You know, we pay for LPN degrees or certificates in our technical college system, one of the great programs that we put in because of the shortage of nursing. But especially in the metro areas, a lot of times you'll hear we're wasting our money because all we want is RNs or BSNs, with somebody with a Bachelor of Science in nursing to work in the hospitals. And they want that year of hospital experience before they go out and do other things. So I think what this committee would do would really look at the scope of nursing practice, look at the education. Are we doing the right things for the educational level they have? You know, should these, especially in our rural areas, could this nurse practitioner, could this RN, could this LPN do more to make sure they're delivering health care to our needed citizens? And unlike our brothers and sisters in Washington, when we talk about health care, we understand it is what is delivered by the medical professionals, not insurance. Washington says health care, they're talking insurance. We talk health care, we're talking about delivering medical needs by doctors, nurses, and other professionals to our citizens. And that's what we need more than anything. So all this committee would do is really look at what our nurses at every different level, every different education can do, not do. Is it right? Is it wrong? What can we do to enhance that delivery system of actual health care? I think it's a great tie-in with our Rural Development Council. It's the rural hospital issues we've faced, the rural medical issues, the shortage of nursing. It really ties it all together, and I think it'd be very beneficial going forward to look at. With that, I'll be happy to stand for questions.
Number 13.
Thank you for bringing this, Representative. I think overall we really need to be having, and I think the Rural Development Council has tried to look at this, but I really think we need to be looking at scope of practice, not just what nurses can do, but what other allied professionals, health professionals can do as well, because you have respiratory therapists in rural areas, not as many as we need to, but, and you have physician assistants, you have.
I hear PAs are good guys too. They do a good
Anesthesia,
job.
yeah, and you also, thank you. And you also have anesthesia physician assistants. And so these are scope of practice issues, not just limited to nursing. I think even pharmacists, you know, you have scope of practice issues there. You know, what can we do to address the scope of practice issues that can deliver, and that's what we're talking about, delivery of healthcare, not health insurance, delivery of healthcare to the rural parts of the state that number one, that are meaningful, that actually get to the patient, that are cost effective. So I would encourage you to broaden your discussion just beyond the nursing profession, because the delivery of healthcare is extremely complex, especially in rural areas, because you may have to rely on a CNA, or you may have to rely on a paramedic who may have to act as a role as a nurse in a rural emergency room. I see that all the time. They hire the paramedics to work in the ERs to basically do nursing functions. And they're not nurses, but they are clinical professionals. We need to look at, as far as I'm concerned, the military corpsmen coming out of the Corps, coming out of the military. Those are highly trained healthcare professionals in the military setting that have to go through the civilian licensure process, and they know a lot more than some of these nurses that are coming straight out of nursing school. And so we need to be looking at that as well. We could feed those folks into our healthcare delivery system. I could talk an hour on this all day long, as you can tell. But we need to talk about scope of practice more wider than what we're doing. And we're getting there, but I think we need to do a lot more on that.
Well, I certainly agree. I'm just, when we start with one, because it can expand greatly, and I think if you get into everything, it could be more than we really want to take on. You mentioned the EMTs, the telemedicine that's available. I mean, last year we sat over in the ag room, the ag building, and listened to a person's heartbeat with a Bluetooth stethoscope in Glasscock County, just as if they were sitting in the room with us. And so there's so much that can do. EMTs was another one we haven't even mentioned those. So my concern would be get it too big. I'd rather do one now and another one later, and certainly anything we can do to help physician assistants, we're all in favor of.
And our foreman too.
Number 12.
Yeah,
Okay.
I certainly agree with my seatmate here, and also across the way. Thanks very much for this resolution. I have been dealing with this for the past year or so. Relatives, nursing homes here, there, and everywhere. And found out that the ones who really doing the work, not the MDs, not the nurses, but the people that's on the lower end, like the PAs and so forth, and doing a very good job. So I agree that maybe if we could broaden this a little, I think that would be excellent. So that's my comments.
Any further discussion? If not, Representative Kirby, thank you very much for your presentation, and I think this is an issue that we need to look at again. I see nothing else on the agenda. Does any committee member have anything they would like to add to today's discussions? If not, this meeting is adjourned.